Okay, good afternoon, everybody. Call this meeting of the Public Health and Community Health Committee to order. And Senator Brass, time is of the essence. So if you will come forward and present Senate Bill 233, and we're working off LC 9804S. That the one you've got?
Yes, ma'am. All right, this bill is a simple bill. I think it is. Sorry. I had to get caught up here. I was just making sure I was looking at the right one. So we are taking the Behavioral Health Reform and Innovation Commission, which our colleague and friend Commissioner Tanner created when he was in the State House, and is currently at 24 members. We're taking it from 24 to 30. So we're giving the governor an extra 2 appointees, the lieutenant governor extra 2 appointees, and the speaker an extra 2 appointees. And that's the meat of the bill. And then we put a end date of December 1st, 2026. That's it.
Committee. Okay, so move to second. All right. Is there anybody in the audience that wants to speak to the bill? Oh, except Commissioner Tanner. You're good with it? Okay. Okay. Jeff, are you? All right, you're going to wave too. And the pediatrics group, is that in on it? Okay, you're okay with it too. All right, so that'll be pretty easy. Any further questions from the committee? Okay, we have a due pass and a second on Senate Bill 233 LC 339804S. Any other questions from the committee? None? All right. Then everyone in favor of the passage of the bill say aye. Aye. Anyone opposed, no? Okay, the ayes have it. Thank you, Senator.
Thank you, Madam Chair. I'd be honored if you'd carry this bill for me.
Be glad to do it, sir.
Awesome. Thank you.
And I've already signed the paper, and your aides got it to take to rules.
Got it. Thank you.
Thank you. Okay. All right. Okay. Senator Watson, Senate Bill 30, and we are working off LC 520659.
Later, I have Dr. Michelle Zena is seeing patients, and she's in between, and I think she's ready to go right now. If we could get her hooked up.
Yes, sir.
Oh, here we go.
Hi, Dr. Zena.
Yes, ma'am.
Hey, nice to see you. Thank you for taking time out of your busy schedule. Appreciate all you do for children on our autism spectrum and the great work you're doing down in your area of Georgia. So, do you want to let her go first and just speak in general, or you want to present the bill, or how do you want to do that?
This bill is a continuation of SB 140, which prohibited surgery and sex change hormones in gender dysphoria for minors. And this comes back and does puberty blockers for that, which is what we're addressing. But Dr. Zena can give us some insight into pediatric and autistic patients and puberty blockers. And she has to go, she's in between patients, has to see another patient. I think she's running a little bit late to see the next patient. So I thought we'd go ahead and just let her testify.
I've got a hot question coming up. I mean, just going to take one that lit up my thing. Representative Oliver, was that you? No, Representative Al. Oh. Can it wait? Okay. All right, Dr. Zia, go ahead.
Thank you. I have concerns about children making decisions that impact the rest of their life. As you alluded to, the majority of my patients are on the autism spectrum, and youth with autism are more likely to experience gender confusion or identify as LGBTQ. So this is an issue close to my heart, but I have no financial interest in this bill at all. In Georgia, adolescents under the age of 16 are not able to consent to sexual activity. Adolescents under the age of 18 are not able to consent to a tattoo or genital piercing. And most OBGYNs think that young mothers under the age of 25 cannot really give informed consent to having their tubes tied to prevent additional pregnancies. So I really don't think that we should be allowing children and adolescents the opportunity to make a life-altering decision that affects them forever, because they don't really understand how to give consent and they don't understand the decisions that they're making. They're not capable. And, I encounter children and adolescents every day who struggle to label their own emotions. Most of them are also on the autism spectrum. And some of them make excellent grades and qualify for gifted programs in school and are great at sports or music or art. But that doesn't mean that they can manage abstract concepts. And they really struggle to understand the perspective of others as well. And this dramatically impacts their understanding of sexuality and relationships. From my perspective, and the more and more organizations in the medical community are coming out to say that biological treatment of gender confusion, as opposed to psychosocial treatment, is inappropriate and harmful.
Try to keep our question short, but Dr. Al, and Dr. Z, I don't really know, Dr. Al's an anesthesiologist. You know each other.
We know each other.
Nice to see you on the screen. Isn't it true that the standard of care for pediatric patients is informed consent with the patient and their parent?
For most things, it is.
So this is a follow-up in making these decisions in concert with family members. Doesn't this push this to a question about parental rights and making choices for their own children?
I don't think so, because when a child encourages their parent to make a decision, and the parent is choosing what they think is best for their child based on the information provided by their child, it's not really the whole picture.
Cindy Oliver.
Good afternoon, Dr. Zenith. Your area of practice is what, please?
Pediatrics with a focus on behavioral health. About 70 to 80% of my patients are on the autism spectrum.
Are you a psychiatrist?
I am not a psychiatrist. I'm a pediatrician.
You're not an endocrinologist then?
No, I'm not. I'm a pediatrician.
Have you ever prescribed for any patient puberty blocker hormone therapy?
No, I have not.
You don't believe for any patients that is appropriate? 18 an adult or 16 a minor?
Well, that's not what this bill does, but go ahead.
That's,
Okay.
I don't think that puberty blocking drugs for gender confusion are appropriate.
In any case?
I haven't seen any case that I thought they were appropriate for.
And your testimony is that you don't believe adults 18 and older should be able to make a decision about his or her prescriptions. Was that your testimony?
No, I'm talking about children.
Your testimony, though, was teenagers over 18 and over. Did I not hear that correctly?
I said that children under 18 are not able to consent to medical related, genital piercing and tattoos. That's what I said about 18-year-olds. You have to be 18 to be able to give that kind of consent.
Final, Madam Chair, the Academy of Pediatrics has a different view. You're aware of that, are you? On Senate Bill 30.
There are pediatricians with a variety of views on this matter.
Thank you.
Okay, one more question, because the doctor does need to go, I think. Representative Reese.
And thank you, Madam Chair, and I certainly appreciate the time that the doctor spent with us. You know, coming in from Columbus, Georgia, I'm up here for 3 months. I leave my family on Sunday and I go home on Friday, so I don't feel comfortable being rushed when asked to address a topic as important as this. We need to make sure we spend the time to address this appropriately. Now, my question is your testimony today that you do not believe that children under 18 have the capacity to make the decisions about this type of life-changing activity? Is that correct?
Yes, I do not think that children have the capacity to make this decision.
So am I correctly in assuming that you do believe someone older than that has the capacity to make that decision, correct?
About themselves, yes.
Okay, but you just discounted a parent. Let me finish my question.
I'm
Madam
gonna
Chair.
let you finish, but
Okay.
your lawyer voice is coming out.
Okay, all right. Well, I just don't like hypocrisy in presentations. But you just said that the parent is incapable of making a decision for the child. But you further say that the child is not old enough to make a decision, but someone over the age would. That just doesn't jive. 2 + 2 is not 4 in that situation. Because if the parent is capable of making that decision for themselves, they should be able to make the decision for their child too. And I'm a strong advocate of parental rights. And I think parents should be able to make their decision for their children. So what other reason, other than you just believing that they're not old enough to make that decision, do you think that children, with the consent of their parents and a medical professional who has examined them and know that they're in the mindset of making the decisions that they are making, other than you just not liking it, what medical reason do we have to try to block this?
Well, in Georgia, that children are not allowed to give consent for quite a few life-altering decisions. For example, they're not allowed to consent to sexual activity under the age of 16. And that's not based on my personal preference. That's based on what the statute says.
So you feel strong
And
that
The statutes also say that they're not able to consent to genital piercings or to tattoos.
So you feel strong enough that the parents should lose their right per state law with the child they have raised from birth, waking up in the morning when they were 2 and 3 months old to give them milk and change their diapers. The person who knows them better than anybody on this committee, anybody in this state, that they should have the right taken away from them to determine how their children and how they decide to proceed with their child's life.
I think that children should be protected from making life-altering decisions that could be very harmful to them.
Children should be protected from their parents. That's what you're saying about strangers that know nothing about what's going on in the household. Thank you, Madam Chair.
Dr. C, I didn't get confusion. Sorry. I don't think anybody was contemplating letting their children. That's not part of this bill, nor has that ever been the concept of the bill of actually letting children on their own make that kind of decision. I don't think that we've ever considered that. And that may be some of the confusion. Okay, I've got 2 more. Can you take 2 more if you got time?
I'll be late, but I can be late.
Okay, Representative Barnes, make it short and sweet.
I'll wait for her. I want to question the senator.
Okay, Representative Choka, short and sweet.
Thank you, Madam Chair. 2 questions. In the United States, it's illegal for young people under the age of 21 to smoke cigarettes because it's dangerous for them, with or without parental permission. Is that not true?
That's my understanding.
Okay, so we've already taken away the parents' ability to provide cigarettes for children if they believe that's healthy for them.
Okay.
The second question is, how many countries do you know that have already banned this practice?
Several. Quite a few countries in Europe have actually reversed from allowing puberty blockers for children to not allowing puberty blockers for children.
I'm going to cut it off that. Dr. Sia, thank you very much. I appreciate you taking the time, and I hope we didn't keep you too long. Take
Thank
care.
you.
Thank you very much for your testimony and taking the time for us. Okay, back to you,
Okay.
Senator Watson.
Sorry that went a little bit out of order, but as you can see, she is a practicing pediatrician in between patients. So let me just sort of digress, since some of you were not in the room, and we sort of got a little out of order there, but sometimes schedules need to be changed, and I'm sure we can all agree with that. We do that every day. So, in adapting with that. So Senate Bill 140 was a bill 2 years ago that forbid minors from obtaining sex change hormones and surgeries for gender dysphoria. That's basically what it did. And at the time, puberty blockers were allowed. Since then, the pendulum has swung. And as you can see, or as you may know or may not know, that Norway, Denmark, and Finland have forbid puberty blockers from minors. And then the United Kingdom, almost exactly a year ago to the date, forbid the same thing from the puberty blockers. Multiple clinics have closed. I think the number is around 70 in the U.S. 21 other states have done this. And it is amazing the number of parents that have had children with gender dysphoria that have come to me privately and publicly to say that they wish that this bill had been passed several years ago. Because though their children suffer from gender dysphoria and the treatment, evidence-based treatment is such that they should receive counseling for quite some time, that unfortunately has not been the case. And that puberty blockers were initiated and transitioning was happening. If puberty blockers had not been initiated or are not initiated, then you allow a natural process called what? Puberty, that we've all been through. And that is a wide fluctuation of hormones. I think that we all can testify. But let me digress a little bit and say that this does not keep puberty blockers from being used when little girls have starting their menstrual cycle at age 6 or 8 years old. That does happen, and puberty blockers are used. It is also used in other situations, in mental health situations, when you're blocking the estrogen or testosterone, that psychiatrists do that. It doesn't prevent that, but it does prevent it in a mental health issue with gender dysphoria or gender confusion. And that's what this does. If I take you through the bill, you'll see one section is relating to hospitals or institutions. You'll see that on line 60. And then the other does that relating to physicians. That's the other part. And you'll see on lines 117 through 120 where it does carve out the other conditions relating that where it can be used and so forth. So that's it basically. We're cleaning up Senate Bill 140 with present day knowledge relating to puberty blockers. And I will note that puberty blockers, and I'm going to pull up on Hippocrates, which is, I'm a practicing physician and this is what I use. And let's look at some of the side effects of puberty blockers. And reactions and so forth. The serious adverse reactions that we see with puberty blockers obviously starts off with allergic reactions and anaphylaxis, but you can have severe skin reactions called Stevens-Johnson syndrome or toxic epidermal necrolysis, where basically your skin blisters and comes off and is a deadly illness. Drug reaction, eosinophilia, and systemic symptoms, and it goes on with other skin disorders, liver toxicity. And the biggest one, the major concern, this is under serious reactions, is bone density loss. So, pardon me? Density loss. So that's the most serious reaction. And you'll see with bone density loss, and And that's sort of obvious. If you lack the estrogen or lack the testosterone, then your bone density is reduced. And that is an issue with this thinning of the bones, osteopenia, osteoporosis relating to that. Pituitary issues, seizures, cardiac arrhythmias, pulmonary emboli, so forth. Common reactions, hot flashes, which would be sort of obvious, sweating, hot flashes, sleep disturbance, some generalized pain, and then depression. And then I didn't mention up at the top suicidality, which is a significant adverse reaction. In other words, increased risk of committing suicide. So not only depression, but common reactions relating to that. So it is not a benign drug. It is something that is significant, and we're asking to do, like the good lawyer said, to protect the minors, and tattoos and genital piercing is not allowed in under 18 years old. Smoking, I thought, was actually 18. It may be 21. And sexual consent, we don't allow that for under 16. So yes, we do protect our minors. It is the right of the state, and it is the actual responsibility of the state to do that. And many parents, again, close to the T, have come and said, I wish this had been done years ago. So with that, I'll be happy to answer questions, or we can have testimony, whatever the chair lady would like.
To answer questions.
Okay.
Dr. Allen.
Thank you, Madam Chair. Hey, Dr. Watson. How's it going?
Dr. Allen?
Nice to see you again. I have some serious concerns about this bill with respect to it impeding standard treatments for established medical indications. And if I could have the indulgence of the chair, I'm going to walk through 3 conditions and we're going to talk about them. We can actually probably get through them pretty fast because the questions are sort of yes, no questions. The 3 conditions I want to talk about are precocious puberty, galactorrhea, and androgen insensitivity
So
syndrome.
all allowed in this bill.
So let's just walk through it because I'm not clear how the bill is written that it actually does allow. So precocious puberty, as you mentioned, is when a child goes through puberty
Mhm.
too early socially, like a 3, 4, 5, 6-year-old having a period. So generally speaking, would you expect female patients, talking about biological sex, female patients at some point in their lives to develop breasts or to menstruate? Yes.
I'm sorry, I was looking at the.
No, I was just saying, would you expect female patients to develop breasts and menstruate, generally speaking? A female patient, yes, okay. So in the language of the bill, breast development and menstruation are considered female patient sex characteristics, right? So should a 3-year-old child develop breasts and menstruate?
I'm sorry.
Walking through the reasoning here
Depending
because-
on if they
Mhm.
have, certain conditions that may cause that, may or may not.
But
be
we
related
recognize
to
that's
the
a
normal
pathologic.
sexualization from that standpoint.
Right, so it's a pathologic manifestation. 3-year-olds should not.
That's right. That's right.
Develop breasts and menstruate. So the treatment for precocious puberty obviously involves the use of what this bill would classify as puberty blockers, correct? Right. It's okay. These are just yes or no questions. We're just
I'm
walking
sorry,
through it logically.
I was looking at the areas there. So the question is what now?
So the question is the treatment for precocious puberty, the standard treatment, are what this bill would classify as puberty blockers.
So precocious puberty is allowed with this bill.
So let's just walk through because I want you to show me where. So precocious puberty involves development of secondary sex characteristics consistent with a patient's sex, but not consistent with their age. Right? I think that's the neat summation of that. So where does this bill carve out that use of these crucial medications? Can you show me the line?
So line 117, treatments for individuals born with medically verifiable disorder of sex development. This was in a bill, the prior bill. This is not a change. This is SB 140.
Including individuals born with ambiguous genitalia or chromosomal abnormalities, resulting in ambiguity regarding. So it's not ambiguous that female patients generally
So
develop breast
you can just,
menstruation. It's an
if
age related.
treatments for individuals born with a medically verifiable disorder of sex development.
My point is, and we've seen this in the past with other legal bills that aim to curtail the standardized best practices of medicine, is that the way this bill can be interpreted could interfere with standardized treatment for precocious puberty.
You know.
Okay, so that's
I'm-
just.
I'm not a lawyer, but
But you are a
that's
doctor.
that is previous language
Mhm,
that you're referring
from
to.
your bill.
And it is my understanding
Mhm.
through legal counsel
Mhm.
that this does not preclude that.
I would find that confusing as a physician, but let's move on to
Okay.
Dr. Rhea.
Wait a minute, I want to say something
Yeah.
about that.
Madam Chair.
That is one of my concerns, and that's just only because I don't have the knowledge the doctor, but I've talked to a lot of endocrinologists and lately, trying to make sure I was prepared for this, that it's not specific, because in the 6-week bill we have,
Mhm,
one of the things that we've had trouble with doctors being afraid to treat
mhm.
ectopic
In
pregnancy
the what bill?
on the 6-week,
Abortion ban.
the abortion ban. We have had trouble across our state.
I won't argue there have been some misinterpretations.
That is what-
I'm not going to argue that, but
No,
I
I'm
am,
saying,
this is not new law. This is old law that was
but as you
established. in
said,
SB 140.
sometimes things need to be changed. I mean, I'm not trying to argue with
Listen,
Senator
if you
Watson.
want to clarify it, I have no problems with that,
I don't-
but
that's the
I
only
don't
thing
think
I
it
was
needs to
saying.
be, but that's okay.
I thought it might be one area that we need to talk about and clarify more. Because I think it is a problem with might be a problem with our physicians in interpretation, because I know we've had it with the other. I just don't want to cause that again.
You know, old language, not part of my bill, but I can understand that.
Okay, thank you. Go ahead, Dr.
I
Bowles.
disagree with it. I understand.
Okay, I understand, sir.
But I hear you saying that's not the intent, but sometimes that's the effect. Just
It's not in my bill. This is old language,
from SB 140, which is your other.
which is 2 years old.
So let's move on to another condition, just so we can broaden this out, because there's a couple of conditions that I worry this introduces confusion in what is considered standardized treatment. So galactorrhea. Let's talk about that for a second. So galactorrhea is,
Or gynecomastia, right?
well, it's different than gynecomastia. It's the production of breast milk
I'm just
outside.
throwing out another
No, I understand.
diagnosis. Yeah.
I understand, yes. So in the language of this bill, would developing breasts and the ability to lactate be considered a secondary sex characteristic consistent with the female sex?
It can be either sex. I think galactorrhea can occur in either sex.
Is it pathologic?
It is
In males,
pathologic,
okay.
yes. In males, it is
Consistent with-
pathologic, yes.
Accustomed standard female development.
Yeah, prolactinoma, I mean, in both sexes, that could certainly occur.
Pathologic, okay, so,
A statin therapy, spironolactone.
Yeah.
You can see that in both
yeah,
sexes.
those are pathologic.
And you can
conditions,
see
so-
that in gynecomastia, and you can see galactorrhea with it
Mhm.
also.
Right, and that's sort of where we're going with this line of questioning. So you're familiar, obviously, with the condition of galactorrhea, just for the audience to know that that's where breast milk is produced outside of pregnancy or breastfeeding, right? So you're familiar with the treatment for galactorrhea? It's okay if you don't, it's been a
It
while.
certainly
since-
depends on what the etiology, what the cause of the galactorrhea is.
Mhm.
If it's prolactinoma, then obviously you're going to either attack the tumor itself, or you're going to give some medicines to keep that in bay, so to
Right, so
speak.
for central galactorrhea, one of the
That's-
treatments that's
that's-
pretty standard is bromocriptine.
Bromocriptine, I
Or
prescribe
other
it myself.
dopamine agonists that
I prescribe bromocriptine, and I've
sure.
had my sister had a prolactinoma removed. So,
absolutely, and that
yes, I
shows
get
how
it.
standard this treatment is. So this would suppress, in the words of this bill, it would suppress or block the production of the hormone prolactin. That's what bromocriptine does.
I
Yes.
know what bromocriptine does.
Okay,
Yeah, I thought you
good.
were
I'm just
referring to puberty
linking through it
blockers.
because
Okay.
right, so this is another type of hormone that is blocked. I don't think it's the type of hormone that's envisaged by this bill, but it is a hormone. This is part of the question about the language of the bill, not necessarily translating or having this pinpoint effect that you envisage when you wrote it. So can you show me where in this bill a physician treating, just like you have, a female pediatric patient for galactorrhea would not be considered in violation of this law and, held administratively accountable, meaning we would lose our license, which is in line 123 through 125. Can you show me where in the bill it allows for that explicitly?
Yes, line 117.
line 117 is like the catch-all for where everything's allowed for treatments. With a medically verifiable disorder of sex development is what you would consider
Mhm.
phylacteria.
Yeah.
No. Is that your understanding of phylacteria, that it's a disorder of sex development? You just talked about a brain tumor. Pituitary adenoma is a disorder of sex development?
It's a sex development. It is, you could look at it that way. Yes, I think
I'm
you
not trying to
could.
give you a hard
Listen,
time. I'm just saying there's a lot of
and
conditions for
again-
which we use these treatments that I worry are going to get swept in this
Listen,
dragnet. of
if you
being-
think that we need clarification of the language from a previous bill, I'm happy to add that in there. If you have some language to offer, that's great. So this is a hearing only. We're not voting on it today. And if we need to make some adjustments, and that's fine. But again, you're discussing language that is not part of my bill that I've changed. This is old language.
We're not working off the right?
Looking at language 117, right?
Yes, sir.
I'm not changing that existing law.
Okay. Pardon? Okay, this was this existing law from the law 2 years ago.
Yes.
Okay. That obviously I'm just taking another look at the law as it came through, apparently.
Right. And listen, if you know,
I
I'm not
I
gonna argue that.
understand. I mean, we've worked together on things before. I understand.
I'm not arguing about it. If you want to clarify that, I'm happy to accept amendments. I mean, this is a hearing.
Just under that point, that I'm not sure that a neurosurgeon or a neurologist would consider a pituitary adenoma a disorder of sex development, which is where the way the law is written, either in 140 or this current bill,
Again, if you have better,
introduces confusion.
if you have better language, I'm happy to do it. The other aspect is relating to what that pituitary tumor is causing. So I'm not going to argue that.
The chairman has agreed to look at the language, and I think that if you would get language
You
and
got language to improve it, I'm happy
to
to.
improve it, he's,
But that would be, again, it's not part of my bill, but that was what was left over from before, but that's what we do.
Yeah, no, I generally have a problem with legislation that legislates the practice of medicine, as you sometimes do too. Like we've worked together, right? You get this.
Sure.
That's the situation you're putting doctors in when they're trying to do their jobs. And it makes it hard for us to do our jobs. And you know that.
Trying to do that. And I think that the composite board would take that into consideration, and I found that hard to believe, but if you'd like to clarify it, I'm happy to do that.
get together with you on this. It's above, obviously conversation a while ago, I know a little bit, but it was above my understanding of what went on, but I think we can get people that an endocrinologist or whatever we need to get us to get the language.
I don't think an endocrinologist is needed. I think
Do you
maybe
think
clarification of the
this-
language is needed, maybe legal legislative counsel. If you want to bring language like that, I would certainly be receptive to that.
Okay, all right. Ready to send you out? You need to get,
Yeah, the one more condition that I want to clarify. Sorry, I know this is going on, but it is really important, right? Because these are the decisions that practitioners are going to be making when they're taking care of patients. So getting to this level of specificity is exactly the problem that we're introducing. So on line 120, there's a section of the bill that introduces clinical exceptions, which we've sort of been talking about. You include in line 20, quote, treatments for patients with partial androgen insensitivity syndrome. So as you know, there's two types, generally speaking, of androgen insensitivity. There's partial and complete, right? So with complete androgen insensitivity syndrome, you have patients that are genetically male, meaning 46XY, but whose bodies do not respond to androgens, e.g. testosterone, during development. So therefore, despite being genetically male, 46XY, they may have external genitalia that appear female at birth, and they may be,
Right. That's sort of
That's
ambiguous genitalia. And again,
well, it's not ambiguous. Well,
it would be ambiguous. And on line 120.
that's partial.
That is not,
partial
that
is
language
ambiguous.
is not changed. If you want to change that language, I'm happy to entertain it.
My question is, so the treatment for these patients with complete androgen sensitivity, which is not included in the exceptions, is in fact taking hormone replacement therapy as defined by the bill or removing gonads,
Yeah,
Right.
and
which would be consistent with their
wouldn't be
biological
illegal.
sex to
This
take
would not
a-
make that illegal.
do an orchiectomy for a 46XY individual is in contrast to their biological sex. So
Yeah.
can you show me where in the bill it makes it?
Yeah, line 117, XXY or medically verifiable disorder of sex development. But again,
This line is like carrying a lot of water. Okay, I mean, I
well,
appreciate that you,
you just said XX or XXY or XYY. I mean, that's pretty close.
I
I mean,
didn't mean to
that's
belabor this
exactly
point.
what that's talking about.
but my point is the fact that there are so many issues that come up introduces whether you meant to, or if you don't feel that it is in the letter of the law, it introduces significant confusion in what physicians can do in the standard of practice that we've been doing for decades, really, for these patients.
If you would like to clarify the language, I'm happy to entertain
I
that.
think
That
it's
is not
a matter of
language that I
clarifying,
have,
but
that I have
legislating The
changed.
practice of medicine with that.
Again,
Thank, and
Thank you. Great.
Hey, the author of the bill has agreed that we can look at the language and present it, and I think we need to move on. You've got there's lights all over my board. Here again. Okay, Representative Cannon.
Sure. Thank you, Madam Chair. Just want to start off by saying I have transgender staff who transitioned as youth in the state of Georgia. I love somebody who is transgender. And so can you tell me more about your experience with transgender people?
yeah, so I'm a practicing physician. I've seen transgender patients in the past, and so professionally and personally.
Okay, so professionally, you wrote Senate Bill 140, which
No, I'm sorry. I didn't, that was not my bill.
That was Dr. Song, and that was Mr.
okay.
Senator Summers.
Okay, so professionally, you saw Senate Bill 140 with some flawed language as it relates to transgender people, and you supported it. The reason I'm asking that is because I'm sure you're aware the term sex reassignment surgery is not a term that is still acceptable. It is called a gender confirmation surgery, correct?
I'm not going to argue with you about your definitions of that.
Right.
Definitions, yeah.
Okay, well, it's written into, we created law that wrote the word sex reassignment surgery in. And so just as you are
Where's
open.
this?
Line 52. One of many. And so my question is, are you open to, as the other amendments that are coming, possibly looking at changing the terms sex reassignment surgeries to gender confirmation surgeries?
It's your committee, and if you think you got the votes for that, have at it, but I don't think you do.
Okay, thank you for that response. My second question, that was the first line, goes to gender dysphoria. As a provider, you've spoken to gender dysphoria. Do you believe it's a real condition?
Gender dysphoria?
Yes, sir.
Yes, I mean, I've been referring to that for the past, 20 minutes or so.
Great. And so what medical solution do you recommend for those living with gender dysphoria?
For minors, I would, what's recommended? What's recommended is the counseling.
And that's it? Because that's not all that's recommended.
Well, that's what should be done for minors, and that's where we have addressed it here, and 21 states have done the same thing.
So your opinion is that the medical solution for gender dysphoria is what is recommended, which is counseling
Counseling for minors.
only?
Counseling includes medicines. I mean, they're from anxiety and depression and other mental health issues that go along with that, the comorbidities that go along with that.
Okay. And so if counseling, do you support conversion therapy?
What's your definition of conversion therapy?
Just helping someone make the decision that they're not going to go through with the conversion of their sexual orientation or gender identity.
Remind me again now, conversion, are you referring to gender dysphoria or are you talking about something else?
Conversion therapy is a counseling mechanism that is used for those as it relates to their sexual orientation and or their gender identity. And so there are providers who believe that the counseling version of conversion therapy
Oh,
is an appropriate protocol for those experiencing gender dysphoria. I'm asking, do you support conversion therapy for those living with gender dysphoria?
I don't think that's pertinent to this bill, but thank you for the question.
You're getting past me, Representative Cannon. Are you trying to get out that you should change people back from what they're feeling or something like that? In conversion therapy, like at one time they tried to
I don't
change people,
know
just,
where you're going with that.
I don't know where you're going with it.
If you'll let me continue, I'll let you know.
I just
Well,
don't,
okay,
I've got one
Wait a
more
minute.
line.
wait a minute.
Mhm.
Okay, at 4:30, we're going to have to break.
Break or leave?
A little break. I mean, I have, and there are three of us, I think, on this committee that are on rules. We will have to leave 5 minutes or so we can get to rules, and we must be at rules. Okay, I want people to be able to answer the questions, but there's more than I thought we would be, and I think we need to at least try to get through the senator, and let's see if we can. I almost felt like I almost needed to have and none that was like this. I'd had people write their questions down before you came, and so why try to pick out your most pertinent question that you want to get at. And here again, it's getting like it's a little bit of a interrogation, and it shouldn't be that way. I'm not going to let the other side do it. So pick a main question, Representative Cannon.
Sure. My last question in the line of asking about conversion therapy is you speaking to those who have detransitioned and the importance of those who have detransitioned. For those who typically are classified as detransitioners, many times they have undergone conversion therapy, and they may modify their approach to their medical transition, but they still continue to identify as their affirmed gender. So my question is, for those who have detransitioned, do you believe that they should face some sort of penalties that are retroactive for their decision-making?
yeah, I don't think this really has anything to do with this bill.
Has anything to do, there is a part of the bill that I have questions about. That is the fact that 2 years
Their mental
ago,
health treatment should be between their therapist, psychiatrist, and themselves.
Okay, I just wanted you to possibly answer the question whether or not anyone else thinks it's germane. There are a number of individuals who have asked me to ask you these questions, and so that's why I'm asking you these questions
And
today.
I'll be
Thank
happy
you.
to meet with them in my office and discuss, but I was just presenting SB 30.
I will tell you, I have problems, and one of the things that we need to talk about going forward, in that 2 years, this state said that people that by a certain time, people could either start therapy with blockers or continue on with blockers. I have a real problem with the retro. I have a real problem with anything going retroactive. Be it tax, changing the tax code and going back and penalizing people like they did in the U.S. Senate years ago, or taking away something as a state we said was okay, and let families and children, parents come together and make a decision. And then we're saying we should take that away when people are in transition.
Are you referring to puberty blockers? Are you talking about sex hormones? Or are
No,
you talking
puberty
about
blockers. Going to do with puberty
surgeries, or what are you talking?
Puberty blockers.
Puberty blockers. So
Yes, sir.
let's answer that. So how long does it take for puberty blockers how often do you get puberty blockers? It's every 3 months, right? How long does it take for the puberty blockers to wear off? It may be 3 months, it may be 6 months, it can be up to 2 years at times. And so it is allowing a natural aspect of life to occur. When you stop the puberty blockers, you are allowing puberty to happen.
But that's not taking into That's one aspect of it. Yes, it does go back. And
I think that's the appropriate aspect of it.
well, I guess I would think maybe what it does to a person a teenager that has decided and is in transition, what it does to them psychologically.
That is what they should-
Have it yanked out from them.
I don't think it's yanking out because puberty blockers is a slow drug. It's not a fast acting drug like sex hormones, which were stopped,
Right.
or surgery, which is
Which was
irreversible.
good. That would
Right.
agree with.
Okay, so sex hormones, when you stop those, sudden.
It-
Puberty blockers, 3 months at a minimum, usually more like 6 months, and according to endocrinologists, can be up to a couple years before you'll go through puberty. But having said that, stopping it or not, when you stop it, you allow a natural process to happen called puberty.
But
And that's what the big issue is.
yes, we're going to disagree on it because that's not what I'm getting at. You're not hearing me.
Okay.
I'm saying if you stop it, that there could be a natural process on it. What I'm saying, what it does to the person, the teenager that has started this and has been allowed for this to go and they won't go into effect. And if the law passes until July and the governor sign it, has been allowed to be by state decree, we said it was legal for them to get it, for the child, for them and parents to decide a child could do this, and they've had a couple of years, and then we decide to change it. It's not about what the hormone blockers did. It's what it does to them psychologically.
And the fact is that they should have never stopped receiving psychological counseling or medicines if they needed to from that standpoint. That should not have happened. And what happened in Denmark, Norway, and Sweden a couple years ago, and then what has happened here in the UK. So.
Representative Barnes.
Thank you, Senator. I am a person of data and facts. So can you give me the data on why is this an issue in Georgia that we're making this law? I know you said it passed in
Denmark, yeah.
I was, been here all day, sorry. So we just put them all together, it passed in those countries. What improved from this passing in those countries? And that's my first question.
Well, I mean, the Scandinavian countries were sort of the leaders when it came to that, and put that in quotation marks. And then they realized that that was not good for the minors, and they stopped that, as did the United Kingdom also. So yes, puberty blockers are being used in Georgia, and
my question was, what improved in those countries? Like what
allowed the children to go through puberty.
Okay. Why is this an issue that you're wanting to do it here in Georgia? Like, what harm is it causing our state?
Well, I mean, according to the parents and the testimony, I think that you may hear, and according to Dr. Zena, making those decisions is challenging for children, especially with mental health issues or autism, who many times do misidentify. Not receiving puberty blockers, I listed the side effects relating to that. So yes, I mean, the first rule in medicine is what? Do no harm, right?
Right.
So puberty blockers have potential to do harm.
And then that leads to my next question is, some of those symptoms that you mentioned can come from not having this procedure, the depression and the suicide.
That is what some people have claimed.
Oh, those are facts.
No,
And
I will disagree with that.
And then my last question is, this bill, SB 30, would be removing that grandfather clause, which was in SB 140, that would allow current youth who are already on this to continue. But this SB 30 is ceasing that, which I feel would cause, which will cause more problems for those children.
I'll disagree with that. So SB 140 did stop sex change hormones. which was a sudden withdrawal, you're correct, and which would be much more side effect producing. And then number two did stop the surgeries that could happen. But puberty blocker stopping those does what? It allows for puberty to take place,
So we're
a natural process.
just want all puberty.
Sure, Oliver.
Thank you, Madam Chair. Am I right or wrong that prescription of puberty blocking medication is within the standard of care for treatment of gender dysphoria? Am I right or wrong?
Well, it's certainly not in the UK, and it's certainly not
In Georgia?
in Georgia right now. Not standard of care, in my opinion.
In your
Um,
opinion, is it within the standard of care if I were a board certified endocrinologist treating,
I think there is a divergence of opinion on that.
and you want to change the medical opinion for Georgia
No, I'm
on
not.
those that support the prescription of gender?
Back to what Dr. Zena said, and I agree with her. No, we want to stop a potential side effect of a drug that prevents them from going into a natural response relating to puberty.
I just want to make sure I'm right, because this is what I think is true, that prescription of puberty blocking medications is within the standard of care in Georgia today.
It is not, to my knowledge, puberty blockers are not indicated for that particular treatment and approved by the FDA. So it is off-label usage. Is it what is being used? Many times, yes.
I think that's something that I would like to have clarified, and I'll work on that myself, and we'll
Okay.
get back to you. Thank you.
I will tell you, I'm not aware of it being FDA approved for that. That is an off-label usage.
Okay. Representative, you through?
Yes, ma'am.
Representative Sharper.
Sure. Thank you, Senator. I mean, I know this is a hearing only, but I think at this time, can I motion to call the question on this and they get with him and everybody get together and get their questions answered or whatever they want to change or get clarification on? Or do we have to do it here right now?
We are getting down to the last days of session. We need to let people have to hear both sides of the story. And
Just saying y'all got to be somewhere, but that's
Well-
up to you. But thank you.
thing.
All right, go ahead.
We have some folks to testify. Do you want to have them testify?
Who?
I think we had several people sign up to testify.
So, one is for you. I have three questions so we can get them short, and I'm not going to double back. Okay, two questions. Representative Drenner, let two that haven't spoken.
I don't know where to begin, right? Seems like we've been down this road before. Senator Watson, are you a pediatrician?
Primary care, internal medicine.
Okay, so if you were referred on to a pediatrician,
Yes.
yes, and then if,
Well, I mean, I wouldn't be treating a child.
right, you would, but you are today talking about children
No.
from the perspective of being an expert. Is that the case here?
No.
Well, that's what it seems like to me, that you are presenting a medical issue from an expert perspective.
I'm presenting SB 30 is what I'm presenting. And yes, I am a primary care physician.
We
internal
are
medicine.
an evidence-based committee. We are. That's one of the things that I've loved about being on health, is that we look to experts. Your pediatrician expert focuses on autism spectrum,
Hmm?
right? So really doesn't treat any kind of endocrine disorders or psychiatric
No, I think
problems.
I don't think that's accurate.
Seemingly, we've got a letter on our desk from the American Academy of Pediatrics that says that the American Psychiatric Association, the American Academy of Pediatrics, and the American Endocrine Society and others all object to this particular
Right,
bill.
there's, and as I alluded to earlier, there's a divergence of opinion in the medical community. There's no doubt about that. Whole
These are pretty
countries,
big societies though, right? I mean, it's
I'm-
not just, I mean, you're referring to
I'm referring to
Uh,
countries and,
Norway and Denmark and Finland. I
yeah,
mean, really?
and the UK and 21
Well,
other
I'm
states,
actually impressed by
and
that.
21 other states too.
Okay, so Madam Chair, let me just say one more thing. So my most important job is being a parent. That's my most important job.
Yeah.
And I have 4 kids. I have 2 6-year-olds right now. One of my 6-year-olds has an adrenal gland problem. Bill, I'm really concerned that my daughter could not receive any care. That her pediatrician who referred her to an endocrinologist on lines 110 to 112, my daughter could not receive care. And we're not just talking about my daughter here, we're talking about everybody's daughters out here and sons who have some kind of parental consent to be treated. And you're saying that this particular bill, that parents have no right to make decisions for their children.
No, what I'm saying is that if you look on line 12, relating to the treatment of minors for gender dysphoria, that's what we're discussing. We're not discussing, and again.
For the purpose
Dr.
of
Al,
delaying or suppressing puberty.
For this is relating to gender dysphoria alone. And if we need to clarify the language with Dr. Al, I'll be happy to do that. But that is already established law. I'm not changing that.
This is a new line.
No, I'm talking about on line
Well,
117,
I'm
18.
looking at a new.
Those are the exclusions.
Lines 110 to 112. This is hormone therapies that are prescribed or administered for the purpose of altering primary or secondary sex characteristics or puberty blocking medications that are prescribed or administered for the purpose of delaying or suppressing puberty. So this bill in particular has, I mean, not only does it impact parental consent, but it definitely has a chilling effect on physicians who are treating children.
I couldn't disagree with you more.
Okay. All right, Representative Taylor. I don't believe you've asked a question.
I feel like we've kind of gotten off track here a little bit. I want to make sure people understand this is a decision that is based on what a child wants. And this is treatment to a minor. And they're not of age to make those kind of decisions, even with parental consent. I happen to know people that have gone through this process and changed their mind. So this is a problem. They were not mature enough when they went through the first process. And I think this is something we need to get back at. These are children making a decision, influencing their parents that this is the time to do it. I have no problem if they want to do it, but wait till they're of age if that's what they want to do.
And that was actually what the author of the bill, when Senator Summers or Chairman Summers, when he did SB 140, after you're 18, you're legal, do what you want to do.
Okay, I will play the devil's advocate on that. I would think, and there's somebody we're going to be able to ask after this, that it would be much harder to change after that time because you would have already developed. I mean, I know I'm not a physician, I'm just a nurse with advanced.
No, you're right. They've gone through puberty.
They've gone through puberty and, they will have the features and all the characteristics of, and so it would be much harder for them to transition.
And much less likely to, probably.
Well, I mean, and that I'm just saying that is also one of the problems with it, apparently. Okay, It is, by the time we walk over, we will be at, we do have, and I think I'm very pleased to have, and I want everybody to be back in here because we have a pediatrician who also is an endocrinologist who treats these children to present. And I think that certainly is one thing that we haven't had, is an endocrinologist and one that actually treats the children. And I think it's very important. And I know I get the feeling you're a little upset with us for even questioning. I hope that's not the way it is. It's just that it's different. We haven't had, and I've been listening to my committee members talk to me about this and what was going to happen. And I'm just trying to give them an opportunity to express how they feel about it, to ask the questions they need to ask. And I hope you'll bear with us. It means some extra time and, perhaps changes that'll make the bill better or take care of some of the concerns, and maybe not. But it's important to me, as one of the people said, and I really appreciate Carla. She has 2 PhDs. She's probably one of the smartest people in the room, if not the smartest. And the fact that we have always tried to look at things on a scientific basis doesn't always mean we agree with everything that everybody wants us to agree with, but we have tried to do that. And so we're going to be on a break. We will come back and stay, and start this up again just as soon as we get back to rules. I think what we're doing is maybe being called to make a vote. I wonder if it's tort reform. I have no way of knowing if it is, but it was important enough that I asked if I could be excused, and I was told no. It's because I was just going to miss rules and continue here. So let's head to 3 of us, and I hope my committee will take a break. Don't get huh? How would I know how long? I am not a mind reader of the chairman.
I'm gonna go pick up.
What do you want, Mary Margaret? I don't know what else to do. What? I am reconvening the meeting and I hope you'll be here.
TBD. Pick around.
Yes, but it's important that you're here. No.